Hello, dear friends. I am very glad to see you. My name is Sofya Dorinskaya. I am the president of the International Bureau for Human Rights in the field of mental health and the director of the Sofya Dorinskaya Medical Information Center. I am a psychiatrist by education. I worked in a large psychiatric hospital in the so-called acute department. And now I am the head of the Medical Information Center. And today I would like to talk about, is psychotherapy necessary for panic attacks? And what kind of psychotherapy should be used for panic attacks? I already have a video recorded about the causes of panic attacks. You can watch it. And to put it briefly, the cause of a panic attack in a person is the activity of the sympathetic nervous system. This is the very same fight or flight range, the very state when a person feels danger, when the body perceives the environment as a threat, and the human body is always ready to either attack, fight, or run away. There are several reasons for this. And first of all, if we are talking about everyday life, meaning when we are not being attacked by wild animals, what kinds of situations are these, of course? These are various illnesses, that is, physical pain. These are the onset of illnesses when the pain has not yet been localized, but is what is called disseminated pain. When it is sublimated or transformed into this emotion of horror, fear, or aggression. It could be hunger, of course. The body is built that way. The body is not designed so that its normal state is a hungry state. Therefore, all people who suppress their desire to eat automatically drop into this range after a very short time. Fight or flight. And naturally, the body is on alert. That's just nature. And it could be some kind of poisoning. That is, again, it's pain. For example, drugs. These are nutrient deficiencies. Pain from which, again, is not yet localized. In other words, these deficiencies haven't developed yet into some pathology where it's fragile and breaks and there's pain. This kind of diffuse feeling then turns into emotions of being unable to live, melancholy, horror, fear, a sense of impending tragedy, this constant emotion that haunts a person. And naturally, people come to us in this state and we run tests for deficiencies. We carefully monitor them and refer them for examinations to the appropriate specialists and doctors. But I also started receiving messages that some of these people are seeing psychologists. And it was a complete revelation for me to find out what exactly these psychologists do, how they work with a person who is experiencing these panic attacks. What does this psychologist do? As far as I understand, this is called working through fear. In other words, the psychologist sits this unfortunate person down in front of them and, using their methods, begins to immerse the person in this fear, or in this horror, or in this despair. And the psychologist says that they are working through the fear. So what do we end up with? We have a person who is already in this suboptimal state, who is already experiencing emotions of horror, fear, the unbearable nature of life, and so on. And what does the psychologist do? They deliberately, using special techniques, make the person even more introverted. That's how it should be shown. Yes, introverted. Forcing them to immerse themselves in this negativity. Moreover, they use certain words there like, your life, excuse me, is crap. You're a loser. Your family is worthless. And people just crawl away in a state of, well, just torn apart, I would say. To put it simply, what this psychologist does is make the person wind themselves up. Yes, and we always know that, on the contrary, when a person sits and winds themselves up, it drives them into an even bigger problem. And people, those around them, the story itself, life itself, always tells you to distract yourself with something else, not to pay attention. But when a person comes to a professional, and don't tell me this isn't a professional psychologist, excuse me, he works in some clinic, he has all the necessary clearances, he has all the diplomas, certificates, and so on. So, ladies and gentlemen, psychologists, this is your professional with all your authorizations. Moreover, he's been working there for almost 16 years. So this person, this psychologist, starts to professionally wind up his own patient. And what do we end up with as a result? In the end, we get an even bigger problem when a person is professionally driven into this introversion, pushed into this horror, and immersed even deeper. And what will we get in the end? We might get a psychotic breakdown right during therapy, and the person will be taken to a psychiatric hospital, where the psychiatrist will finish the job, finish off this unfortunate person. We will see an escalation, we will see a worsening of the condition. And the psychologist can quite calmly say, I suspect you have an endogenous disorder. Again, they send him to a psychiatrist, and the psychiatrist finishes off this unfortunate person by diagnosing him with schizophrenia. But the truth is that a person who is in a state of terror, fear, or panic attack should never be made to introvert and work through their negative emotions. Do you understand? So, ladies and gentlemen, psychologists, if you do this, this is exactly why people call you the waiting room of psychiatry, why they call you the waiting room of the mental hospital. Because this is so unqualified, so unprofessional, and the result you get is absolutely predictable. This is simply a deliberate immersion and provocation of a psychotic breakdown or a severe neurotic breakdown in a person, which you then easily diagnose as a sign of endogenous illness and send them off to a psychiatrist. What should you do? Ladies and gentlemen, you should not allow anyone to participate in your psychotherapy trainings unless they have a certificate stating that they are completely healthy. If someone comes to you with a panic attack, the very first place you should send them is to be examined by non-psychiatric doctors. Because the first thing you must and are obligated to suspect and determine is whether this person has any underlying issues. Is there some kind of pain that the person is not yet aware of, or is it something chronic that has already been wearing them down? Does he have some kind of pain, some kind of suffering that is actually causing and pulling him into this BABD range? Is this person in the middle of some kind of diet? Are they a vegan, a breatharian, or anything else for that matter? You see, in spring or autumn, these are deficiency states when people really, during these periods, can experience panic attacks precisely because their bodies are suffering from a vitamin and mineral deficiency. And this again brings a person down to this baby G range. It is your sacred duty to suspect that the person may have some kind of illness. If someone comes to you, fine, they have an illness, but something needs to be done about it. You should not use any techniques that immerse the person in their negativity and thus wind it up even more. This negative flywheel will suck them in and send them into psychosis. No. What should you do? All your actions should be aimed at extroverting this person's attention. These are any exercises involving observing the surrounding nature. Their attention should be directed toward the objects around them. You can simply go outside with this person, walk along the streets, and encourage them to pay attention to this building, that tree, this flower, this asphalt, and that cloud over there. In other words, you must do everything you can to pull their attention out of this fixed state of pain, which is being transformed, sublimated within them into these negative emotions. You must do everything you can to pull their attention outward. That's the first thing. And the second part of your work should be to find out what this person's environment is like. Are there people around him who exert pressure on him, devalue his worth as a person, work to destroy his life, and so on? And during the conversation, help him either improve his relationships with these people or, for example, take a break so he doesn't have to see his oppressive boss for a while, or something else along those lines. If a person is suffering from some illness but has convinced himself that fasting will cure him, please guide him onto the right path and explain from a scientific perspective that such things should not be done. In other words, everything you need to do, all your work should be aimed at calming down this person's environment. Maybe you could suggest that he go to a health resort somewhere with birds, forest, water, massages, and staff who are always smiling. Anything at all. If he always dresses in black, you could suggest that he wears something colorful, and so on. These are already some... You see, you have the tools to improve a person's life. But the most foolish and terrible thing you can do when someone comes to you with panic attacks is to turn their attention inward and spin the flywheel so much that it carries them away, all the way to a psychotic state and into the acute ward of a psychiatric hospital. It's not just the least intelligent and most unprofessional thing to do, it's also the easiest. Because when I tell our clients that they must do everything they can to pull their attention out from within themselves and direct it outward, it turns out that this is much harder to do. It's much easier to just sit and start to wind yourself up like this, to throw ashes on your head, to look for some flaws. Sorry, but you don't need much brains for that. But true professionalism lies in actually encouraging a person to defixate from this internal state and turn their attention to their surroundings. To give the instruction that if you find yourself in this state, you eat, follow all the doctor's orders, and then once again look at your surroundings. You don't plunge into the abyss of these agonizing shitstorms of emotions. That is professional, that is effective, and it truly requires intelligence, intellect, and effort from the psychologist. So if there are psychologists watching me who sit and pick apart the client's problem together with them, just stop doing that. Because all those exacerbations, psychoses, and sending people to the acute ward of a psychiatric hospital are, to be honest, the result of your unprofessional work. If there are psychologists watching me who don't do this, then I hope this video has helped you outline your work with these people, with people who come to you with panic attacks, and make this work more structured. I wish you success with your clients. And I really hope that if people with panic attacks come to you, you truly help them get out of that state. This was Sofya Dorinskaya with you. Thank you for your attention.